So not a whole lot crazy new this week. One thing did come out in the last couple of days that I wanted to point out. As I'm sure you're all aware by now, the American Rescue Plan Act of 2021 included something for COBRA subsidies. And the Department of Labor issued FAQs yesterday that clarified a little bit of this, but basically under and this is the COVID stimulus bill signed by President Biden last month, there's a 6-month period during which employees who are laid off or terminated can actually get basically free COBRA. And it doesn't just have to be folks who have been laid off or terminated or resigned even during that 6-month period. It's anybody who is eligible for COBRA during that time period. And DOL will send out the link to this in the email that we send after the town hall every week. But basically the FAQs answer some of the questions that I think a lot of employers are asking, which is, first of all, the employee is not going to be required to pay the premium and then get reimbursed. And I think that really helps from an administrative point of view, because it just adds another layer if the employee pays and then gets reimbursed. Instead, the employee pays nothing. They just have to elect COBRA, and then the employer will get paid back essentially through tax credits. And there are notices now in the FAQs. So again, something important to have. And I would imagine that your benefits folks, your benefits administrators are on top of this. But if you want to read a little bit more, the FAQs are a few pages long. So like I said, we'll send that link out in the email that comes out after the town hall. And then I'm going to retread some of the ground that we talked about last week, because I think it's really important and we're getting so many questions around vaccinations. And I think this Glassdoor survey is really interesting around what employees are thinking. We saw that the results of our survey as to when employers are bringing people back and how much you're bringing people back. And I think your employees' reaction is going to depend, at least in part, on vaccines. How many people in this workplace that I'm going back to have been vaccinated? So according to this Glassdoor survey, 70% of employees believe that they should be required to get the vaccine to return to the office. Interesting, right? Because we see vaccine hesitancy among a significant percentage of the population. More than 3/4 intend to get COVID vaccine when it becomes available to them, right? But 24% therefore do not. So what can you do as an employer to incentivize your employees to get the vaccine? And I'm going to talk about that in a second. And 68% would be more likely to get the vaccine if their employers incentivize them to do so. So what are you incentivizing? You guys have heard me talk for weeks and weeks on this town hall about carrot versus stick. You know that I'm not a huge proponent of mandating vaccines, but that I would love to see you try to encourage your employees. We've seen some employers, some of our members, do lots of different fun and interesting things. They've done their own town halls with Q&A to try to address some of the concerns that their employees have over vaccines. They've done bonuses, and I'm not going to read through all these, but these are some national, easily recognizable employer names who have done various bonuses and other incentives to get their employees to go ahead and get vaccinated. And yes, we will share these slides after the town hall, so you don't have to write these down. We'll provide them to you. What other things can you do? I've got one member who I talked outside the box thinker. They are planning, once they get to 75% vaccinated, they're going to have some sort of a celebration in their workplace. Don't know what that celebration is going to look like, but they're going to have some sort of a celebration. So what kinds of things can you do? What's going to be important to your workforce, and what can you do to incentivize? And then we can look to the pro leagues, to the national sports leagues, for what they're doing. And it's pretty interesting because not only are they doing individual incentives, they're also doing team incentives. And this is not just players, these are all the people associated with the team. But Major League Baseball, for example, if you can get your team to 85% vaccinated, there are certain benefits that the team can have. And so I think that's another thing that you can think about as an employer. Now, you can't just start dropping mask mandates. You can't just start dropping social distancing, because those are still mandated, at least in our area, under state law. But what are other things that you can think about? I have a member, for example, who currently has their employees masking and face shielding. Okay, they're going above and beyond the state requirements for safety. And they've said once we get to a certain percentage vaccinated, we'll let people start taking off their face shields. We'll just go to masks. We'll just go to what's mandated by the state. So what are the creative things that you can think about? So this is what Major League Baseball is doing. Again, this is what the NBA is doing. What are the creative things that you can do in your workplace? What are the things that are going to resonate with your workforce that might incentivize them to get vaccinated? I think that the obvious ones are giving them paid time off to go get vaccinated, giving them paid time off to recover from any kind of a complication from the vaccine. I did see for the first time yesterday, one of my members said that they have been able to get a vaccine clinic to come to their workplace. I'm going to try to get more information about that, or it may be that our vaccine expert from the Department of Health can give us more information on that. But now that we see the vaccine availability opening up, it may very well be that you're going to have an opportunity to run a COVID vaccine clinic, much like you may have run flu vaccine clinics in the past. And I know for me personally, for years and years, I worked for an employer who brought in a flu vaccine clinic, right? I got the flu vaccine every year they did that because it was easy. All I had to do was walk down the hall, stick out my arm, and I got the shot. And I think if as employers, we can make it that easy for our employees, more of them are likely to get the COVID vaccine. So stay tuned on that. Hopefully we'll have more information on that soon. And then I did want to touch on the travel guidelines from the CDC on the fully vaccinated. And I think this is another one of those stay tuned kind of a things with regard to the fully vaccinated. I fully expect that in the next 30, 60, 90 days, we're going to get more from the CDC about things that the fully vaccinated can do or are recommended to be able to do. And I think that might help, again, incentivize more people to get the vaccine. So with regard to domestic travel, CDC has said that fully vaccinated people can travel within the US. They don't need COVID testing. They don't need post-travel self-quarantine. Just keep taking those precautions, the mask wearing, the social distancing, et cetera. International travel is going to be a little bit different, at least travel by plane to get into the country. At the moment, testing is required. So the CDC is not changing that at the moment. But stay tuned on that as well. I think we're going to see a lot more and more about what the fully vaccinated can do or are permitted to do or are recommended to do as we go forward. So Kevin, do we have questions?
Yes, we have a couple that came in. And again, a couple of questions were from the last one regarding level of impairment for marijuana. And as Amy said, I would encourage anyone to think about the impairment training, which covers both alcohol and marijuana use. It's more than just a simple answer on that, and really about the process you would go through to look at that. One question, the company is keeping COVID vaccine cards, and the person wants to know if it's okay to do that, even though they may or may not be trained in HIPAA.
Yes, so EEOC has said that it is legal to ask for proof of vaccination from our employees. The key there is just send me your card. I don't need to know if you haven't gotten vaccinated. I don't need to know why not. Assuming again that you don't have a mandatory vaccination policy. But yes, it is legal to ask for the vaccine cards. What you're doing, keep them in a confidential medical file. That's the right thing to do, but it is okay to ask for that information.
Okay. This is a good question. So, which I think we'll hear more of these. If another employee wants proof that somebody has been vaccinated, what is the company's obligations on that?
So I've gotten this question a lot, and I've been telling employers to tread lightly here. There's some debate as to whether or not the fact that someone has been vaccinated is medical information. It probably isn't, but I still think it's confidential information that your employees don't necessarily want to have shared. I had a member ask me, for example, as part of their campaign to encourage vaccination, can I give an I've been vaccinated button to my employees who've been vaccinated? And on the one hand, it sounds great. I think that might be sharing information that's a little bit too much for some employees. They're not going to want to share that, in part because it might be confidential medical information. But even if it's not, we know that this process around vaccination is kind of a hot button. And I think you'd be surprised at the debate it may start in your workplace if if those kinds of conversations take place. So I would definitely tread lightly in that area. My recommendation would be no, we're not going to identify who's been vaccinated and who hasn't been vaccinated, at least not right now.
Then we have a COBRA question. Well, someone brought up the J&J news that came out today. Like you said, there is a lot of noise out there in terms of should I get a vaccine, should I not? On the one hand, that doesn't help, but on the other hand, I think you can point to the fact that the FDA is being diligent, and I think it's 6 cases out of 6 million or something like that. But nevertheless, it's a very dynamic space, which makes kind of mandatory, I think, all the harder right now to impose as an obligation. But yeah, it certainly didn't feel like good news, Rick, when we're trying to convince people to have that come out today. COBRA question. The question is, are you saying if an employee retires April 1, they would not have to pay for COBRA? I believe it's not voluntary termination. It's only involuntary.
I believe it actually is both, but check with your benefits provider. Obviously, they're going to have the right answers for all of this. And it's only a 6-month period.
Yeah.
So keep that in mind as well.
And there are specific forms that have to be sent out. So definitely either your benefits broker or your COBRA administrator is kind of, everyone's gearing up for all those reports. And I don't believe that needs to be sent. Someone asked a question, does it need to be sent to all employees? I think it's only to terminated employees.
I think that's right.
Okay. Let me just make sure we didn't have something else slip in while we were speaking here. Someone said, I may have missed it, but do you say the CDC is requiring full vaccination for air travel? I think it was recommendations.
No, this is just the recommendations for folks who have been fully vaccinated. You're not going to have to go through any of the pre-flight testing or the post-flight testing that someone who hasn't been vaccinated is going to need to do.
Okay, and then we had a question: if we do not get a copy of the vaccine verification, can we treat the employees not vaccinated for the purpose of no quarantine or not wearing masks? So they're taking their word. Again, I think, like you mentioned earlier, the mask requirement is still in place.
Right.
And
yeah,
you got to be able to get verification.
Yeah, I'm not taking anybody at their word about anything right now. That's for sure.
And basically, they have to just copy that card that they received. So
yep, it's very easy. Take a picture of it with their phone, email it to you.
All right, I believe that's it. Somebody asked a question about regulating CBD oils. Again, my understanding is most CBD oils are touted as 0 THC, so they're not subject to marijuana regulations. But again, that's just a real high-level comment on that. All right, so hope you got something out of today. Again, very dynamic space, marijuana, as well as the CDC and so on. And next week we will have the Department of Health, unless something changes, talking about the vaccine rollout, which again is critical to all these conversations we're having. So thank you. Have a great week. Amy, thanks as always, and we'll talk to you all soon.
Bye. All right. Have a great week, everybody.